Welcome to Town Administrator's Report. I'm David Watts Jr., and with me is our Town Administrator, Steve Maio. Steve, welcome.
Thank you, David. How are you today?
Good. We're into fall.
We are. Nice, crisp days. I love it.
It feels like fall out there today.
Fabulous.
And joining us this month is Anthony Chui, who's our Director of Health and Human Services Department here in Wakefield.
Thank you, David.
It's been over a year since we last saw you. And also with us is Melissa Lawry, our public health nurse, and she's actually here for a purpose.
Yes.
And we're going to be getting
As opposed to the rest of us
who are just here to talk. That's right. That's right.
She actually has a job to do.
During the show, we're going to be getting our flu shots. So, but let's start off. We're getting into fall. What's the status right now of COVID-19?
Yeah, so as we enter fall, COVID-19 levels are lower than they were last year at the same time. But we're expecting with indoor gatherings picking up, as well as other events, we're looking to see COVID-19 increasing. We now have news that there are 2 new subvariants that are on the radar now in the New York area. These have been increasing in numbers pretty rapidly. So we're expecting this fall and winter to see an uptick in COVID cases again.
And how are these emerging variants? I think they're BV and BQ.
That's right.
How are they affecting how health departments are looking at COVID for the coming months?
Yeah, so I think we are definitely in a different spot than we were last year at the same time. So we have entered the endemic phase. COVID will be with us for some time. But we are in a better spot in terms of having effective vaccines. We have tools that work, such as masks. And we still have the same information that we had before, is that this is affecting seniors more so than our regular citizens. So something that we're looking to is to maintain our vaccine availability. So we worked closely with our local pharmacies as well as our local health departments to provide multiple opportunities to get vaccinated. Mm-hmm. We have a very effective bivalent vaccine by Pfizer and Moderna. This should protect more so against Omicron variants. We have seen this help with milder symptoms. Mm-hmm. So these vaccines will not prevent infection entirely, but will help to lower the course of infection.
Not unlike the annual flu vaccines that we get.
Yes, so flu vaccine also very important. It's been reported that we are in for a more serious flu season. This could be due to the last 2 years being masked up, and so there might be more exposure this year. So we're also encouraging everybody to get their flu vaccines as well.
Do you see mask mandates coming back as things get worse?
It's hard to predict, and I think now that we're in a stage where we have more information, I think we should be pushing personal responsibility more so at this point. Judging based on your circumstances, people that you will be around, if you want to protect others, masking is the best option. It's hard to predict if we will go back to the mask mandate. It is a tool in the toolbox, but I know Wakefield, everybody has good neighbors, so everybody will be looking out for each other. So I think masking is a great tool.
Mm-hmm. Mm-hmm. If I can jump in, Anthony, first of all, congratulations on surviving the first year.
Thank you.
No. A great and welcome addition to the staff. I know we're going to talk about how the Health Department and Human Services is moving forward in a minute, but I did want to get back to the vaccines for a second. Do you think that over the coming years, we're going to see like the flu shot is kind of tweaked every year to whatever strain they think is coming? We're going to see a COVID-19 kind of tweaked every year sort of booster type shot.
Yeah, based on what we know right now, we're expecting some innovation along with the COVID vaccine. So I'm sure they'll be responding each year to different variants to make the vaccine most efficacious. I know they're looking into trials right now of combinations of flu and COVID vaccines. So that will be coming down the pipeline hopefully relatively soon. That makes it even easier for access. Right. But to answer your question, yeah, I think it's a great idea, and I think they will be looking to alter this COVID vaccine to keep up with it.
Mm-hmm. Great.
So it's important to understand that we've come a long way in the last 2 years.
Yes.
And that it is not the fear-mongering sort of event that it was when it first came about.
Yes.
So, are there still concerns about, for instance, international travel and somehow that having an effect on how COVID behaves in this country?
Sure. Yeah. So I think part of the evolution of COVID essentially is that those that are vaccinated and over time when immunity wanes, the virus is able to inhabit these people and they're able to go through mutations, and that's how these variants come about. On a larger scale, we're talking international travel, that opens the door for other variants that may develop from outside the country for folks to be traveling and pick up and bring back, right? So I think that's the main course of transmission for new variants from outside would be the international travel. So it will be important to keep track of now. The difficult part is a lot of our testing from before that gave us these accurate numbers of COVID are no longer required. So PCR testing was kind of our main tool to keep track of numbers, to figure out variants, but because of the advent of at-home tests, which are great, the rapid tests are great to have as a tool, we don't have as accurate read of numbers. And so we depend a lot on wastewater numbers from our major cities that keep track of this to kind of give us a better sense of COVID levels within the community. But I think in terms of international travel, this will have an impact for families that are going out on vacation and in school and work. It will definitely affect those as well. So I think it's always important to rely on the rapid test as well, but the PCR test is also available at many locations. So that would be a great idea to continue doing that.
Well, and kind of the reason I brought up the question is anyone watching the news over the last few weeks will have seen the reports on China is still largely locked down.
Yes.
Across the country. And I don't know if there are other nations that are behaving similarly, but unlike Europe and the U.S., for whatever reason, they still feel the need to have a almost total lockdown of their society.
Yes.
And does that somehow indicate that there is aspects of the disease that we still need to watch out for?
Yeah, and I think different countries have taken different approaches. I would say the zero COVID policy, in China and other places, that has its merits. It also has its drawbacks. Whether we like it or not, lots of people got infected here, and so there is some level of natural immunity that builds up. And so for those that have very little exposure, when you go into lockdown completely and then you try to come out of it, a single infection can sweep through a large group of people. So I think we're in a good spot because we have vaccine very widely available here. And I think the full lockdown model, barring any major changes, I can't predict the future, but barring any major changes, I think our approach of getting as many people vaccinated as possible and keeping up with boosters is the most effective.
And speaking of boosters, one of the things we're doing today is while we do the show, we're going to be getting our flu shots.
Yes.
And Melissa's going to be very kindly giving this. But you were telling us about glove wearing.
Well, it's true that it's always helpful to wear gloves. They're not required. They're really more for the protection of the person who is giving the shot than the person receiving the shot. You want to protect yourself against blood. But most of the time, if we use hand sanitizer, that is sufficient for shots like flu shots.
I just want to give a quick shout out to Melissa and the rest of our team for putting on these COVID and flu clinics this season and last season. It's just been a great effort. It's a monumental planning process and preparation leading up to them. We're still offering more flu clinics coming up, open to the public, but we do have drop-in flu clinics as well. They are every Wednesday from 9 a.m. to 11 a.m. Is that correct?
I believe so, yes.
So every Wednesday, 9 a.m. to 11 a.m., you can drop into the Wakefield Health Department at 5 Common Street to get your flu shot. You can call ahead or you can register on the spot. We're happy to help you.
And you've also been at the farmers market. You've been at
Town Day.
Town Day.
Day,
I know Town Day. You had probably 200 walk-ups. Or
Yes.
something.
Yes.
we
Which is
did.
great.
Yep.
And that was actually the impetus for this show when you did when they had the health fair down at the farmers market in
Yes.
August.
Yeah, the health and wellness fair was great.
Yes, which turned out to be quite the event.
We were there doing blood pressures that day.
Yes.
Covering everything so people can stay well.
Yes.
Yeah.
I don't really want to know what my blood pressure is.
No, I'm sure there are days where you definitely don't want to know what your blood pressure is. Well, let's go ahead with the shots while we continue talking.
And I'm happy to go first while I'm right here. And I did
All right.
want to point out that I knew I was getting my shot today, so I did model. So when you do go in, wear something loose, a sweatshirt or something if it's chilly, and pull it up so they can very easily get it to your arm. So that's make it easier for the nurse for the healthcare worker giving you the shot, and just easier for you as well.
Well, also thank you to Steve and all the volunteers that came to all of our clinics. Steve came to our COVID clinic and spent a lot of time there helping us with administrative duties. We couldn't do what we do with our clinics without all of our great volunteers.
Yes.
Well, luckily, that's one of the things that Wakefield can be very proud of is the volunteerism
Yeah.
that we see.
I know that, and I've said it before during the first.
Okay, I want you to put this arm down.
Okay. See?
Just relax. Okay, go ahead. Keep talking.
During the first COVID-19 booster, which was limited to, certain people, they were healthcare workers, people that were older, it turned into a gathering of sorts because people hadn't seen each other in some cases close to a year.
Yeah.
And, volunteering at that, thank you, was
Sure.
absolutely so overwhelming and so personally satisfying for all the volunteers that thanks are wonderful, but really not necessary.
Yeah.
To see, people felt that they could live again a little bit. And then came back in a snowstorm 2 weeks later and live again.
Yes.
But thank you. But that wasn't a pain at all. I usually tease our public health nurses that this is their chance to get me, and they say they have the square rusty needle that they're going to pull out for my. But that was nothing. Thank you
The
so much.
large
Square rusty needle. Yeah.
Yes. Let's talk a little bit, you were talking about some of the social aspects of what the health department is doing today.
Yeah.
And let's talk a little bit about that, because there's a certain intersect, we've had conversations with the chief of police about the social services that the police now offer. So let's get the health department and maybe kind of where those two intersect a little bit.
Sure. Yeah. So the police in Wakefield are a great establishment. They have been amazing in providing services to its residents. I think they're very progressive in their model, and they've worked very well with the health department for many years. And to supplement their work, they currently have a jail diversion clinician who does amazing co-response and comes to us with cases. And so what we really wanted to accomplish was to provide wraparound services, right? So in a crisis situation, the police intervene and the jail diversion clinician also intervene.
Mm-hmm.
But the follow-up is almost just as important. And I think our expansion to health and human services has allowed us to bring on a social services coordinator. His name is Jason Stone. He has been amazing in helping residents access all different sorts of resources. That could be gas and light resources, that could be food pantry, working very closely. Melissa Lawry is on the board of the food pantry here in Wakefield as well. Working on different services in terms of housing, just all these issues that it's very hard to seek on your own. And I think filling out applications when you don't have the resources, when you're working all day and you have to go home and take care of other things, having someone there to support you is really important. And I think the social service coordinator position that Steve supported so much for us at the last round has been so helpful, I think, because Wakefield residents have been able to access resources that are already out there.
And I think these quality of life issues, very proud of our community, has been ahead of the curve of our surrounding communities for decades now.
Yeah.
And what Anthony said is completely correct. And we are just really, unfortunately, there's still a lot of people we aren't reaching.
Right.
So I will say anybody that is watching this program that if they feel they need some assistance to contact our health department, to contact our senior center if you're a little bit older, contact our police department, contact my office, and we can, put you in the right direction, because it is so important and vital to the community. And thanks to the community for voting for all these positions, voting to fund them at town meeting, from the Board of Health to present to the budget, to the town council to support it, to the finance committee to support it, and to the townspeople at town meeting to support it unanimously. These really big investments in public health. And interestingly enough, we just went through a bond rating exercise, or surveillance really, with Standard & Poor's on Wall Street, because we went out for some bonds. And I am very nervous going into those meetings, because we have the highest bond rating available. We can only go down. The best we can do is stay the same, which is what we're striving for at this point. And not only with the questions from the bond agency about, where are your finances, where are your reserves, how are you budgeting, where's your stability and your management team, but they also wanted to know not only how much money you had, but where were you putting it, and asked very pointed questions, specifically around, some of the jail diversion and programs that we have with the police department and the public health department, and actually efforts we're making in green energy, which we are. So to me, it was really a very different analysis.
Right.
And I will tell you that between the last bond that we went out for, the last borrowings, and this last borrowing, and the borrowing before, because of that bond rating, we've as a town have avoided, if we just dropped one tick, probably over $950,000 in interest. So think about having a much better credit report on your own level. You can get a lower interest rate on your mortgage. That's what we did. So the investments that we've made in the health department and the services not only benefit the community, but also somewhat pay for themselves, not only in a social aspect in helping people, but in a financial aspect as well. So really was quite eye-opening to me, being in that call, and I've had a few over the years, and eye-opening, I think, for the community. So
But
great
it
job.
also shows how things have changed with regard to public health in general.
Yeah.
When we were younger and polio was still a problem, basically
Well,
the
when you
public
were
health
younger, I
response,
didn't have to worry about it yet.
you're not that
Not
far
that
away.
far, but far enough.
Close enough.
Close enough.
But the public response was quarantine the house,
Right.
and that was pretty much it. Now there's more of a forward look to public health. What can we do to prevent something from happening? What can we do in a timely manner to mitigate what's going on, and not just wait until it's a crisis?
Right, and I think Anthony hit it on the head by being proactive and avoiding problems.
Right.
Investing in that, we're actually saving money in
Right.
the long term, and saving heartache.
But it also isn't just health, it's mental health, it's substance abuse, it's any of those things that all come into the same area that's being addressed.
Exactly.
And we've seen so much improvement over the last 2 decades. And not just in Wakefield, but in general.
Yes.
But we want to point to exactly what's happening in Wakefield and how the townspeople are benefiting from that.
So I think it's important to note that our health department is not just about inspecting restaurants and offering shots to people. It's doing a lot more.
Speaking of which, do we want to
Yes.
get the shots going
We
over
want to
on
make
this
sure,
side?
really, the cameras need to zero in and see the wincing. See how strong he really is.
I also want to go over, mentioning substance use prevention and mental health. We have a great program headed up by the Wake Up Coalition. So Catherine Dingra has been amazing in bringing these programs to Wakefield. One of which is the youth mental health first aid classes. And so we are offering those to the community. The first session is actually today, October 19th. So we have 2 sessions. We also have an October 26th session. for youth mental health first aid, and this is really focused on our most vulnerable, our students, our students. And so we have a great focus on mental health and substance use prevention, but we also talk about trauma. We talk about self-care. We talk about how social media and bullying, how those have evolved over time, because I think with the great advent of all this technology and being able to reach other people, we have to keep up with that.
Yeah.
And so, once we acknowledge the fact that mental health and substance use is a really big deal, we can then start to address it. So I think these programs are really important for us to continue doing, and the support of Wakefield residents coming to these programs has been amazing.
Yeah, it's the public events that have been like the aforementioned Farmers Market Health Day, just really brought the crowds out.
No, I think we have to go where the people are too. So that's the other issue.
Yep. What other, you not only cover Wakefield, but you cover Melrose.
Yes.
How is that position helping both communities in being able to look at each one?
Yeah, so we're lucky to have the shared expertise across the city of Melrose and the town of Wakefield. The sharing of resources is absolutely a benefit. One example would be our recent grant that we applied for. So city of Melrose, town of Wakefield, and town of Stoneham actually applied for a Department of Justice grant 2 months ago, revolving around the prevention of school violence. We received word 2 weeks ago that we received this funding. This is a federal grant. I believe we had a total of 11 recipients nationwide, and we were designated as one of them. So the school districts work together, and Catherine has helped Emily in Melrose as well to pull this all together. And we're in line to receive $1 million over 3 years. So we're going to be able to fund 3 adjustment counselors, 1 for each district, for 3 years, fully funded. And we will also be using the money to provide training. We're going to be providing resources to teachers, to families, to staff, anybody who interacts with youth, to really give them the tools to better serve our community. So we're very excited. I know the school environment has changed drastically. It does every year, but especially with COVID and the return to full in-person, I think it's now more important than ever to have this resource.
Absolutely.
So we're excited to partner with the schools. Doug Lyons is an amazing superintendent here in Wakefield. He does an amazing job, and we're happy to work closely with them on another project.
And I think another big part of that grant is that because we applied collaboratively with our communities, with our bordering communities, Melrose and Stoneham, we definitely got moved up on the ladder of being consideration for it. So I know that when we started regionalization many years ago, and some people, it should be, very, hometown team, that's it, right? They're very, but really by combining, we increased our pool of citizens, which allowed us to jump into a little bit better category, and that's a great grant. Congratulations to your whole team.
Thank you.
Think about adding that to our school department when it's so needed. And I'm much more interested now that I'm a grandfather like you and have kids in the school system. We care much more, right?
I'm not sure we cared less. We just cared differently.
We care more, I'll tell you right now.
Thank you, Anthony, for that update, and thank you for the flu shots. But I do want to take the last 5 minutes.
Nothing at all, not even a pinch.
It was
nothing.
It was great.
Great.
Well, we'll have you come and do shots every year.
Yeah.
But during a show when we're thinking about other things. But I do want to go over some other things that are coming up in the next couple of weeks. Election Day is Tuesday, November 8th. Early voting is available beginning this weekend on Saturday, Sunday, and Monday for this weekend and the following weekend. Absentee voting and vote by mail is also available. And please check the town clerk website for details. All of it is there. I'm assuming WCAT probably has it up on the calendar too. Regular town meeting, which will be...
If I can talk a little
ahead.
about the voting by mail in a second, and for a minute. If you feel that you don't want to mail your ballot back. Because it could get lost and things happen. We have a box out at Town Hall that is very clearly marked, election or ballot or.
Can't miss it.
Can't miss it. Or you could bring it in
Yeah.
if you want, if you're
Yeah.
more comfortable. So certainly that is something that is very available to everybody. I think it really has increased participation, and I will tell you, our town clerk is adamant that, and shall I say dictatorial? Yes, I shall, because that's where she is. Is that if you come in and you have the paperwork to accept that ballot, it's going to go out as soon as possible. So it does a fabulous job and has really increased the pool of people able to vote. So kudos to them. But if you are old-fashioned like me and you want to go down on election day, you can do that too.
Yep, absolutely, and that'll be at the Galvin
At the Galvin, yep.
from
7 a.m. to 8 p.m. And there are a number of races, so you should come down.
there are a number of important races.
Important races, yeah,
Yes,
statewide,
important races. Governor, Attorney General,
Yep.
our own congressman,
Our own congressman, yep.
our state rep,
State
one
senator.
state rep, and one is unopposed.
I think both state reps are unopposed.
Both state reps
I
are
think both
unopposed?
state reps are unopposed, and there is a contest in the Senate.
Yes, yes. So, all good stuff. And then we have a regular town meeting coming up on Saturday, November 16th.
Saturday, November 16th, again at the Galvin.
Yeah.
A great location for a town meeting. It's actually nice to get back there. Again, we were there for the spring town meeting as well. We will have a closed captioning available again for those that maybe have a little bit of need a little bit of help in seeing the articles and what have you. Unlike voting, early voting and what have you, or by mail voting, you need to be at town meeting to vote. That's the way our system works. It is an open town meeting. There is no way around that, and legally. So
Right.
it should be it will start right on time at 9 a.m., I promise you. And we'll get through those articles and get everybody on their way, I would imagine, by noon. So,
And we'll talk about the articles in the next town administrator's
Yes.
report in November, which will come just before town meeting. But, but right now, there are how many on there?
right now, I think there are 6.
Okay, so it should be a fairly quick meeting.
Some very important things, though.
Good.
Important things for the community.
Good. And we'll also have a lot of new projects and things to talk about as the show goes into 2023. Hard to believe we're coming up on the end of,
About our 15th year, maybe?
this is the end of season 14.
Yeah.
We'll be starting season 15 in January. So, long time, long time. But, and once again, Anthony, thank you very much for coming in and updating us. And Melissa, thank you very much for the shots.
Thank you.
You're very
You know,
welcome.
and some in the staff here at WCAT have also availed themselves of getting their flu shots today, so that's a good thing.
And thank you for all the good work in the health department, really. It means changing people's lives, so thank you so much.
It's been a positive change
Absolutely.
in town, which is really nice, really nice. Thank you for joining us. See you next month.